Yes, I'm just going to talk about how our telecare and home care services work in a joined up way and how it works day to day, some of the main features and benefits. Both services are managed within an overarching care services, and this brings a number of advantages in areas such as operational standards, communication, continuity of practice, monitoring and service delivery. On a practical day-to-day basis, the telecare services access to our IT communication system, which is used by home carers. This enables our telecare call handlers to identify the location of an individual home carer and their scheduled visits to help them identify the most effective form of response. The members of the responder team in the telecare service have all worked in home care previously, so they're trained to understand how the home care service operates and closely link in with them when required. Joint working can also be seen in a number of key areas, but there's certainly been an increase in the use of telecare to assist service users who leave the house unsafely. Property exit sensors can be installed in these circumstances to identify those risky situations. Where the service user also receives a home care service, the carers will set and reset these devices to ensure that they are only operational when the service user is alone. GPS devices can also be used in circumstances where the service user may be at risk outside. For those users who are socially isolated and have no family nearby, we depend on the home carers to ensure that the device battery is regularly recharged and the service user is supported and encouraged to wear the device to enable alerts to be raised when they get lost. On the other side, on the home care side, telecare calls and information and data can really provide a rich stream of information to inform assessments and reviews for home care users, and it also can help identify if changes in care packages are required. I think the biggest impacts of this approach, I think, can be best seen in enabling hospital discharges. Telecare is increasingly been seen by colleagues in acute as an essential service to facilitate safe hospital discharges. It provides comfort to health professionals, care services, users and their families, particularly in those early days after going home, where the patient is more likely to be at the most vulnerable. Telecare can also support a home care reablement approach after discharge. But as these services are withdrawn and the level of care stabilises, usually to a lower level, access to telecare can reassure the stakeholders involved in this that there's support out with the scheduled visits by the home care team. In terms of hospital admission avoidance, our service has a significant impact in minimising the number of service users presenting at A&E. 90% of our users who have uninjured falls are assisted by our responder teams and therefore not required to go to A&E for further assistance or assessment. Conversely, when an ambulance attends, around 90% are actually transported to hospital for further assessment, which places some pressures on an already pressurised system. There's a number of challenges that reduce that impact. Discharge dates can be changed, as you know, at short notice, and this can be challenging both for the telecare and home care services to start service within those quickly adjusted short notice timescales. Another challenge, I think, is a lack of awareness from various stakeholders of the impact that some telecare equipment can have on the user, family and service, where the risks haven't been properly considered, or it's been based on the patient's behaviour when in hospital. I think there's some perceptions by users, and it might be the way it's conveyed to them, where they misinterpret the role of telecare services as a form of home care on demand. This can indicate the inadequacy of the person's care package, admittedly, but it can have profound operational impact in telecare service responder teams' capacity to support a service user. To support pressures on existing service provision, the joined-up approach really can help. I think we also need to look at the informal carers situation because they rely on both services, but we need to give them support as well. The role that families play in maintaining people to stay at home can be taken for granted. The constraints on available resources, be it in terms of funding or recruitment, can narrow the ability of formal care at home services and telecare to deliver that support. This means that there has to be an effective partnership where families provide support and they in turn are supported by home care services and particularly telecare. The 24/7 nature of telecare service means it's available to reassure families and provide peace of mind that there's help when that on-site care is not being delivered, and they don't necessarily have to stay with a parent round the clock in case they need help. There are some considerations I think we need to take into account when contemplating introduce a similar type approach to service delivery. In terms of joint working, we need to be aware of the boundaries and capacities of each of the home care and telecare services. There is a risk, and we do see it in action sometimes, where both services are under extreme pressure and their ability to support each other can be compromised, and working together can also be affected by this. So I think you need to be clear about what you can do and what you can't do, and what contingencies you make to manage those risks when that happens.